Hi, I'm Dr. Steve O'Brien. I'm an internal medicine specialist here at Valley View Hospital. I'm going to talk today about skin health. Most people take their skin for granted. It's our largest organ. Of course, it covers all of you. And we don't always think about protecting it or taking care of the rest of our body. So when your skin is healthy, you're healthy. Or said another way, when you're healthy, your skin is healthy. Plenty of water, good diet, exercise. And if I had just two recommendations for the average person, I'd recommend a bottle of skin lotion and a bottle of sunscreen. I typically recommend unscented lotions and skincare products because the fragrance in some of these products can be the most likely thing to cause irritation, especially a person who has sensitive skin, prone to eczema and acne and things like that. The fragrances tend to be the most irritating, and unscented lotion is a better choice. And non-drying soap is critical too, especially in our dry climate, like a Dove unscented or even a Cetaphil if a person's prone to eczema or dry skin or dermatitis. The other thing I always tell people about their skin is a daily sunscreen. Any exposed skin, even if you're not going outside, a SPF of at least 15 is what experts recommend, but I personally use 30 or 50. Sunscreens today are FDA regulated, they're broad spectrum. Most people didn't use sunscreen in the past. They kind of wanted a tan. It was kind of a cultural bias. People wanted to have a healthy tan. Now we know that the sun damages our skin, causes skin cancers. And unfortunately, sunscreens were not very good until about 1985. They only prevented a sunburn. They didn't really do anything to save our DNA like the broad spectrum sunscreens are available today. Symptoms and red flags of unhealthy skin tend to be pain, discomfort, itching, cracking, peeling, scaling. We always worry about moles that are changing for signs of skin cancer. The two most common types of skin cancer are a little more subtle. Basal cell carcinoma affects 1 in 5 people. Squamous cell carcinoma, less common, and of course the killer everyone always worries about, melanoma, the most serious skin cancer, can take a person in the prime of their life. But compared to other cancers, melanoma is rare. It's definitely worth monitoring for, and there's good education online about how to monitor your own moles, and experts actually recommend you undress completely and between yourself, possibly a mirror, possibly a partner, look at your skin head to toe at least once a year, and then seek medical advice if you find anything that concerns you. The most common skin cancer is basal cell carcinoma. In fact, it's the most common cancer of all. And if you include basal cell carcinoma in cancer counts, 1 in 5 Americans will have a basal cell carcinoma in their lifetime. Squamous cell carcinoma can arise out of these precancerous conditions, actinic keratoses. There's scaly spots that occur in sun-exposed areas. They often don't give too many symptoms. They just kind of look scaly and red, and 2% of those can turn into squamous cell carcinomas. The deadly killer, melanoma, is more common in men than it is in women, and about 100,000 people a year are diagnosed with melanoma, and 71,000 deaths occur from melanoma every year. The other two skin cancers are far less aggressive, and basal cell carcinoma will never kill a person, but they can eat off a skin structure right down to the bone. Squamous cell carcinoma can spread into the regional lymph nodes and throughout the body about 2% of the time. Other skin problems that people run into are lumps and bumps typically, acne, folliculitis. A lot of these can be treated at home, and most people can be helped by their primary care doctor. The primary care doctor ought to be able to help you with about 80% of your skin problems, and if they can't, they ought to be able to refer you to a dermatologist. But the most important part is just pay attention and bring it to the attention of your doctor.